Welcome to another episode of Influences in Dentistry. I'm Dr. Geeta and I'm excited to share the inspiring conversation with you today. Let's dive in and learn from another amazing dental professional. Hi, I'm Dr. Geeta Perks. I'm the CEO of Dental Focus Marketing, and I'd like to welcome you to our new series called Influences in Dentistry, where I speak to and have real conversations with inspiring dentists who tell me about their journeys into dentistry and their dental educational courses. The reason why I'm doing this is because I believe as dentists we have our own unique stories to share, and it's not just about our successes, it's also about our challenges and how we've overcome them. And I hope that this is going to inspire our dental profession to do better, to be better, and to take dentistry to the next level. So I'm really delighted to have Dr. Alex Khominsky here with me today. He is a periodontist in Melbourne's southeast, and he has special interests in systemic health, aesthetics, saving teeth, implants, and reconstruction. He also has a deep commitment to advancing general dentistry and has created the General Dental Residency, which is called the GDR. It's an institution that helps to support young dentists and established dentists, and he has mentored over 200 young dentists and ADC dentists. Yeah, and I'm really curious to find out more about that. So thank you, Alex, for joining me.
Thank you so much for having me. I'm excited to share, my stories and learnings and see how we can help people.
Yeah, absolutely. So let's start. I like to start from the very beginning, before dental school. Did you know at a young age that you wanted to become a dentist?
Good question. So I come, probably like many listeners, from a migrant family and grew up, I would say, in Melbourne, originally from Ukraine, and probably education was always a focus of kind of growing up. And I think, as most parents do, they want to try and support you in having and creating a success that is greater than their own.
Yes.
And I think first generation migrants always have, the hardest challenge in that. So I'm very kind of grateful for that from my parents. And so then kind of, I guess, also growing up in parents who were employees and working. So my dad's in IT, my mum does sonography. There's probably also a more traditional kind of mindset around that.
Yeah.
I didn't really have a dental influence as such, but kind of reflecting through and towards when I was 16 probably, I kind of realized that I wanted to work with people, wanted to work with my hands. Enjoyed, I guess, teaching and education. That was probably actually one of the things I had listed on my VC and kind of professions that I was interested in. And one of the advice I had was you can always teach in a profession. And so, learn a profession and then teaching can always kind of follow through in that.
Yeah.
I probably had more traditional concepts of teaching and tertiary institutions, and then dentistry kind of fit those interests of working with people, working with your hands. I think medicine and surgery would have probably been the only path I would have looked in medicine. Probably like all of us, we don't really know what we want to do, and part of it is probably blind faith and a stubborn ignorance that this must be the only thing for me.
Yeah.
But I probably would have found interest in medicine as well. But I think what deterred me from it was, the lack of flexibility, and that your time, not necessarily financially, but your time is really tied for the next 15 years.
Mm-hmm.
And you don't really have control of that. And I had a really inspiring experience when I was 16 at a large dental clinic, very famous, and just inspired by that and seeing that experience. My work experience was going to a dentist, but I just saw surgeries, and I would assist for surgeries as a 16-year-old, and full arch rehabilitations. And so I thought, this is what all work experience is like at a dentist. And little did I realize that most general practices are not like that.
Yeah.
But that kind of concreted that decision to do dentistry, and I even had a scholarship to do medicine in Melbourne and turned that down to take a dental position in Adelaide where I didn't get a scholarship.
Yeah.
So that's kind of where the decision was made. And then from, I guess, general family, I think the flexibility of time, just fit better.
Yeah. So then that's an amazing start already, and you had those opportunities to have the just experience before going into uni. And then you graduated from the University of Adelaide, and you came top of your class. And what did it look like for you then to come out into the real world as a dentist? Did you come out all confident and knowing? Did you know what where you were going to work, what you were going to do?
It's a really great question. I think a lot of people might be surprised. I think I got very lucky that so I was in Adelaide and wanted to come back to Melbourne for family reasons, and really did not consider the job application and what that looked like, and probably understanding, because I think at university level you are, and probably less so these days with social media and the exposure, even we're talking about dental influencers. I don't think as a student I had a dentist I followed necessarily on social media as a student myself, and that's going back less than 10 years. So a lot has changed, and I know the exposure of dental student now is a lot greater.
Yeah.
And I didn't realize back then how that, 80% of dentistry in Australia is private, mostly small business.
Yeah.
And most of that is, a lot through connections and networking.
Yeah.
Being top of your class actually has no benefit whatsoever. And maybe this is like one of the very few industries where it actually matters so little.
Yeah.
Because in the end, most practices are looking for someone they can trust.
Yeah.
That gels with the team.
Can communicate
is probably the biggest factor.
Yeah.
And then, they hope they can grow and have someone stay on.
Yeah.
And so I didn't really, and probably the other factor was I didn't realize that all my connections were in Adelaide.
Ah, yes.
And so moving back to Melbourne, I knew a few dentists, but especially as a new graduate, you need to know dentists or practices that have hired newer graduates before, and so that was well outside of my radar. And so I applied, I think, 60, 70 different practices around Victoria, and kind of I still had time, but I was fortunate that the Alfred position and the new graduate full-time role came up, and I applied, and by October knew that I had got that position. And so that kind of just took that pressure off a little bit in terms of, because I didn't have that many private practice offers. I had maybe something here or there, but nothing that really felt great.
Yeah.
And so, got lucky that kind of job started, I think it started January 2nd. After a music festival, I think my next day was at that, and
a little bit random, but
it was just kind of the New Year's music festival, and then January 2nd you starting, and it was intense and a really great experience where you do have structure, you do have support, you get to do really amazing healthcare. You're working with the most unwell, medically compromised patients who are going through heart transplants, lung transplants, patients going through leukemia and cancer treatment and needing dental care.
Yeah.
Things that you see in your surgery textbook that you learned, and the stuff in pathology and maybe saw once in the rest of your career.
Yeah.
I got to be privileged to see that in my first year. And there was wonderful consultants in special needs, in oral medicine, denture work, sleep apnea. So I had a really kind of profound systemic kind of involvement and a multidisciplinary involvement in terms of working with different medical colleagues.
Yeah.
And it was just, yeah, a really privileged experience that you can't, those patients really can only be treated in a tertiary institution.
Yes.
And so, it was just kind of a privilege to have had that experience. And then that kind of gave me the buffer of figuring out
what you wanted to do.
Yeah.
So it's really interesting. So what was the turning point for you then to become a periodontist? Because I remember as an undergrad, I had a periodontist who would come in and teach me about pocket depths or debridement, and that wasn't really that inspiring for me at the time. But this is over 20 years ago.
Yeah.
But what was it for you? And was there anyone who inspired you to become a periodontist? And did you see something that you just went, yeah, this is it?
I think it's a great question. I think most undergraduates probably still have the exact same experience of what periodontics is.
Yes.
Because the experience is really focused on, non-surgical periodontal treatment, and I think, the limitation sometimes of a public system is that you may not get to follow up that patient as much as you would have liked.
Yeah.
And being kind of a chronic inflammatory disease and the behavioral changes and all those things, and then obviously you're not experienced, so you're not necessarily providing the treatment. And the way I describe periodontal care, it's a little bit like doing endodontics, but without being able to take a PA and know, have I done a good job?
Right.
Because you're in the dark, it's all tactile, hand instrumentation.
That's right.
And you can say I've done a good job, but you won't know till you review it in 3 months' time.
Yeah.
Whereas endo, you can take a PA and be like, okay, I did a great job and I'm good to go.
That's right.
And so you can have this kind of false sense of, I've done a good job. And then 3 months later, you're like, oh, the pocket's still deep. I probably didn't have a singular periodontist that I think inspired me. I think I probably took it more back to trying to think about pros and cons and decisions, and I think sometimes also we can get into a decision paralysis, but you don't actually have to decide on doing periodontics until someone offers you a position to do periodontics.
Oh, okay, yes.
And so you can kind of create the paths and steps to have that opportunity present itself and maybe not overthink the process of getting there.
That's a good tip.
And then, when someone offers you to do the postgrad program, take it if you want to take it and don't take it if you don't want to take it. But I was kind of thinking, I think just long term I realized and maybe it stemmed from my experience when I was 16 and I saw the surgical side and was inspired by that side of things.
Yeah.
And then my kind of medical influence and the foundational health experience kind of lent me towards, okay, if I want to focus on one area, which area allows me to have the combination of the things I enjoy doing?
Mm-hmm.
And so from that, the surgery in periodontics can vary depending on the periodontist and the type of practice that you have. The way I had a friend describe it, it's like maxillofacial surgery, but it's like the light version. It's like 98% fat-free. You've got the so you get to enjoy it, but don't have to
do the whole
facial reconstructions and the significant nerve paralysis and all of that kind of challenges that come with that. And so probably from that I realized, look, periodontics is probably the field. You get to do the surgery, you get to focus on health and the foundation, and it's not as maybe glamorous these days saving teeth, but you get to focus on that. And so just that balance kind of fit really well. And so I did a concurrent research honours during my dental degree. Adelaide allowed that, so that was just fortunate. I don't think I would have taken a year off to do that separately. And did my primaries the year after. And that kind of led into the path of what I chose.
It's incredible. And I just wanted to know then mentorship. So you started to mentor dentists and guide them, and what drove you to that? And did you feel that there was a gap in your education that you felt that needed to be answered, for others? How did it begin?
I think the mentorship lent into back when I was 14 and started tutoring, and I loved the teaching side of it. Maybe it's something just naturally I enjoyed, maybe as like a teenager and you made $30 an hour tutoring and you were inspired by, wow, I can try and help someone and be compensated for that. But then I just realized that, and the way I've kind of reflected on in education spaces, I guess there are things that you enjoy, and there are people, and we're privileged in dentistry, I think, that unlike a lot of other professions where you can have a direct impact on someone's life. If they come in pain and you get them out of pain, if they have aesthetic concerns and you can help in terms of their confidence, and things that can happen relatively quickly. And a lot of people in professions don't get that privilege necessarily. They're working on long-term projects. They may not even know the clients, or be a cog in a bigger, obviously, vehicle of delivering care. And so we're kind of very privileged. And then education is kind of one step where, well, I can only treat so many people, and I can only try and give so many patients, perhaps my philosophy and my impact on improving their healthcare and their experience. And then education is a step back. Well, if I can help, hundreds or one day thousands of people in terms of helping them figure out how to be the best version of themselves and how they deliver healthcare. Well, the repercussions on that is a whole, multifold effect in terms of the people you can help. And so, coming back to your kind of a question in terms of where that started, I think during university I was involved in student society and in the education portfolio, and later in other positions. So that was kind of always there, and that kind of mentoring and buddy system. And when I graduated, again, I had the privilege of the Alfred position, and me and a friend, we started thinking, well, we're looking at the UK as a model with the vocational training, the US, which has a similar kind of style of healthcare as here in many ways, but also has options of vocational training, or do they call it general practice residency, or there's another advanced general dentistry programs. But we really don't have many kind of programs or structured paths for growth for newer graduates. And so I think that was just a feeling amongst me and him, and a feeling amongst our peers. And I think for most, you're fortunate if you land in a practice with a good mentor and good support.
That's right.
But often, there's still so much you need to grow, and dentistry has, and I think universities get a lot of flack. But the challenge is, dentistry in the last, let's say, 15, 20 years has doubled, tripled. There used to be 2 or 3 crown materials. Now there's 5 to 10. I won't even get into aligners and orthodontics. Wasn't even a consideration. Implants, and so there's so much that's, in endodontics it was hand filing. Now there's rotaries. Now there's 10 different rotaries. But the dental degree has only stayed 5 years or 4 years. And so the amount of time for universities to condense all that information has stayed the same. And so I think it's just kind of created more education that's needed beyond. And so we were trying to kind of create, okay, let's go to this CPD course, let's go to this one for this. And we just kind of thought to ourselves, can we create something that just covers the fundamentals of what it is to be a general dentist and set someone up to have, that great career and the great philosophy and a focus on comprehensive care. Because I think we know that if you don't have that kind of support and structure and growth in your first couple years, sometimes those who've had good experience can look back and be like, oh, well, of course, that's natural. But having been involved in 200 different dentists and all manners of types of workplaces, and if you don't have a good initial support, it can really set you back many times over and be very hard to psychologically overcome, or just from that standpoint, confidence, but then also knowing what to look for. And so that's kind of where this came about, and then just has...
I think that's absolutely true. I think I was very lucky that I had great mentors that helped me in my early years. So then you created this curriculum for the GDR. And how does the GDR focus on core skills as well as those advanced procedures, and guide those dentists to then get the confidence to then bring it into practice?
So the way, and this is our we're going into our 5th iteration of the program. So every year we've developed, taken on feedback, adding more things on CAD/CAM, more things on a stronger focus on hands-on for different elements that we get. And so the program is 12 months. There's 5 weekend hand-on modules over that 12-month period, so roughly every 2 months. And so through that content, we'll cover communication, photography, treatment planning. We have a composite module, and where the advanced is, we'll teach anterior aesthetic composites and injection molding techniques. And so for the dentists who maybe already have a few years of experience and feel comfortable with, let's say, more of the basics, and that's where they want to elevate. So they get that hands-on experience. In our endodontic module, we cover core molar endodontics, but we also cover perforations and retreatments, again, for the person who is more advanced and wants to learn there. In our surgical module, we'll cover extractions, foundational implantology, socket grafting, and again, those who want to start in that realm can start utilizing those techniques, restoring implants and understanding that concept. And then we have a pros module where we'll cover kind of veneers, onlays, resin bonded bridges, traditional bridges, very comprehensively. And then the other way we gear things is everyone gets grouped into a mentorship group. And so that's kind of where it's tailored further. So those who are new graduates are together and they get to share from their experience, and the mentor can focus on a new grad. Those who have several years experience or have particular goals that they want to achieve, we'll place them in a more advanced group. And so they'll present cases and share their cases. And so they don't just learn from their own experience, but the 4 or 5 other people. And they get guidance from the mentor in terms of treatment planning. And so that's done online on a monthly basis, and there's a chat system for ongoing support.
So I guess this helps to build that confidence, because they're not just seeing that one case, they're seeing multiple cases and getting the input from everyone. So that's...
and realizing that the question this person has is probably the question they'll have next week, or the case they'll see, and also seeing, and things go wrong or don't go the way we want. How is that rectified? That's sometimes where the most learning is coming from. This veneer didn't look the way I wanted to look, how do I fix it? And that's kind of part of the support, and the mentoring really is because you can do a hands-on workshop, but it's about making sure you implement that into the practice.
And I guess one of the key components is your hands-on. So in terms of the hands-on, do you get really good feedback from that?
Yeah, we do. I think dentistry being on people, ideally everything would be a hands-on on people, and you'd be working in that environment. But we try and replicate that as best we can with models, as many do. Our focus though is, I think what we try and do differently is we understand everyone's time is probably their most valuable commodity, and so when they come for hands-on, a lot of the lecture content is already pre-recorded and they can watch prior, so it's not half lecture, half hands-on. We try and really have it 80% plus hands-on, so that people are just getting in the repetitions, getting the mentor or the speaker over the shoulder, giving feedback, because I think that's where, from a hands-on perspective, that's where you kind of get the most.
I think that's great. My next question is really about what motivates you, because you are busy, you do part-time in terms of the periodontal work, and then also you're doing education. So what drives you? And is it anything dental or is it non-dental?
It's a good question. I think I've always probably had a mindset of, if there's something to be done and an area to focus on, or an area where you can have, I guess, the greatest impact on people, and then I just kind of focus in on those areas a little bit. And so it's probably what drove me to specialize, and that time commitment. I think there's, as many clinicians probably say, as you get more experienced, clinical work is very enjoyable. You know, it's a great privilege, and you get that impact on people straight away. There's a real deep sense of value that you get internally, and it's a selfish thing, but it's, you know, and that's why a lot of people help others, because, you know, there's that internal driver. But I think what I found is I have a deep passion for that health aspect of dentistry, and, you know, hopefully one day maybe creating a bit of a change or a focus in people and dentistry on more of that side, of the systemic health side, and periodontics. And, you know, it's a condition that affects, the recent Australian Institute of Health came out, you know, over 50% of our 65-year-olds and above have moderate to severe periodontitis, and 45 to 65 have 30% of that population. So a very prevalent.
It is.
And despite a lot of things that have tried to be done and instilled, there hasn't really been a change in that number. And so, and then the question is of the type of practice and the quality of care that can be provided, and how many teeth that we can save and extend and give people the best quality of life. I think there's a lot to do there. So I'm passionate about that. And then I think education, like I said, just from being a teenager, was just something I realized, again, you can have an impact there personally with patients, but then if you can create a whole generation, or, you know, I can't believe, looking back, you know, it's been 200 dentists, and maybe impact them to go on this structured path of growth and become just the most amazing dentists. And some of them, you know, honestly really have, and aspire to them as well now. And being able to kind of continue that growth for them and create just, hopefully, just an incredible profession. So those two things, I think, are enough. I really try to.
What about outside of dentistry? Anything that
between those two and family, there really leaves little time for much else. Young children keep you up and don't give you sleep when you need it most sometimes. So I'm very lucky, and I think sometimes the challenge is not biting off more
than you can chew.
Then you can chew, but also that you can stay true to each of those things. And make sure you're delivering and accountable and performing well. Because the reality is you're going to drop something, and that impacts the whole purpose of it all.
My next question is something that really excites me, which is about the future. And if we had the crystal ball, and we're looking into the crystal ball and seeing, what do we think that the future is going to be for general dentistry, periodontal, you know, aspects, and also implantology? Do you have any ideas of what you think it might be?
I think looking at the trends of things and social media, I think social media will continue to be probably a driving force for growth, and websites and your whole marketing strategy, which is obviously a lot of what you focus on. And I think that becomes no longer probably optional for practices, but a requirement for newer practices, especially those who maybe weren't established 30 years ago and have that kind of clientele. But in terms of practice, it is really interesting. I think, we see practices who've changed the landscape, especially in the cosmetic space, from aligners and those. And I think it'll be interesting to see whether there can be an evolution in a health aspect for dental care. And there's a term, functional dentistry, and I'm not sure what the right term for it is. To see whether that, and probably with the right marketing and a right plan, maybe that's where it'll be. But I think there's the trend of implantology and full arch rehabilitation and implants and all those things will continue. And I think, again, from an education standpoint, I guess being in a practice where we see implant complications on a daily basis, and patients who've had all on X treatments and 6 years later have severe periimplantitis and complications, and being told there was their lifetime kind of guarantee or warranty or whatever it would be. And often the hardest things to change are the risk factors and the behaviors that led to the deterioration of their teeth. And so, as we know, behaviors within ourselves are the hardest to change. And so I'm hoping that the next evolution is something in that realm.
Yeah. Interestingly, I've read an article about a biopharm lab which has created an antibody that is stopping a protein in the body to produce teeth, so the third teeth. So you've got primary teeth, secondary teeth, and then potentially tertiary teeth. They're doing this in mice at the moment, but I think that would be a game changer, because you'd be looking at caries and advanced caries and thinking, maybe we're not going to save this tooth, and it would affect how we treat the patient, whether they're doing endo or even implants. Maybe it's
look,
teeth.
I think if we go into that realm from a periodontal and probably just in dentistry in general, there's a big trend in medicine of, we're still very kind of mechanical in our approach. Caries. There's been the change into the whole remineralization and that influence of care. But then obviously from a cavity or periodontal disease, it's a lot on debridement and then oral hygiene, and there's not really a personalized approach. And in cariology, it's a little bit different. But particularly in periodontics, where depending on the person, 30 to 50% of the risk factor is from genetics. And when we say genetics, as you say, there's potentially proteins and gingival clavicular fluid and certain kind of proteins or markers in there, or there might be things within biofilm and attractants for certain species of bacteria. But also we know that the host inflammatory response, and it's the body's overreaction. And so probably similar, and where we're seeing this in medicine the most is probably some of your chronic inflammatory diseases, but also in certain cancer treatment, where they're starting to use genetic markers to provide a specific kind of drug therapy that's targeting that person's genome more specifically. And so probably the future does hold some form, and there is trials for things like vaccines and things like that in periodontal disease to prevent periodontitis from occurring. But even that is not necessarily specific to an individual. And so that's probably where there'll be a salivary test that you spit into, and that gives you a risk profile. Perhaps there's, we see micronutrients, vitamin D is an interesting one in terms of, about 50% of Melbourne essentially deficient. And so and then one of the challenges
it's
sometimes...
everyone in Australia, isn't it?
Well, maybe not Queensland or Northern Territory, they're probably doing okay. But the rest of us...
Yeah.
But it's interesting because although we have 50% who are deficient, the challenge there is just because you're deficient, you may be utilizing vitamin D still to an appropriate level.
Mm-hmm.
But also you may not absorb vitamin D capsules, and although a blood marker might indicate something, there might be a utility issue as well.
Yeah.
So I think as we kind of unpack that pathway of things, that's where I think we'll have more screening tools, more individualized care, whether it's in a supplement, a probiotic in a vaccine form, or drug therapy of some sort, especially for patients who probably have the most severe forms of disease where edentulism and tooth loss is a big factor.
Yeah.
And then in terms of regeneration, I think eventually we will probably see some sort of tooth regeneration
structure.
Yeah, I mean, look, we're 3D printing
Yeah.
materials all the time now, and and there's a kind of a concept again in medicine, in transplants is a big one, where they're looking to take the biomarkers and genetics of a person and take, let's say, in a lung, a scaffold that's been pre-printed, customized to the patient,
right,
and then implant your own cells that have been kind of reformatted in a healthier way, and then that cells are impregnated into the lung tissue to create a live lung that then is transplanted in.
It's incredible, isn't it?
And that's kind of where the tiers, obviously it's going to start where it matters the most, and then work its way down.
Incredible. If there's anyone out there that's wanting to know more about the GDR, or even referring patients to you, how do they find out more about you?
Probably the easiest is on Instagram at drkominsky.perio or at General Dental Residency. And otherwise, feel free, we can put up links on email, and feel free to reach out.
And do you have any social media handles?
General Dental Residency and drkominsky.perio.
That's lovely. My last and final question really is, what's next? What's next for your career? What's next for the GDR that's going to excite you about it? So,
I think in terms of GDR, I think we're excited that we've now had dentists who've been with us and started with our original program in 2020, and it's been 4 years.
Yeah.
And so they are more advanced. And so our journey and our philosophy was always take a dentist from beginner to expert.
Yeah.
And so the residency is kind of where we felt there was a big gap in the market, I guess, and a place where we could help people the most. But our next step is to help general dentists, and that's the majority of the profession, to advance in more advanced skills. So we'll be looking at more advanced programs. We're kind of releasing a diploma in advanced restorative or prosthodontics next year. There's going to be another kind of area of interest that will kind of, these in the pipeline as well.
Yeah.
And then personally, I think continue building that philosophy of periodontics and seeing how I can help and influence that more in the profession and amongst the general public.
Yeah. Well, thank you, Alex. I really feel like I've learned a lot from your inspiring journey and your transformative role that you play in general dental education. Dental Focus Marketing is really proud to help support the GDR, and I want to thank you for sharing your story and just keep inspiring those dentists to do great things.
Thanks so much.
Yeah, thank you.
Please note, the views shared are personal to our guests and not official advice. All treatments carry risks. Consult a qualified health practitioner to determine if a treatment is right for you. For surgical or invasive procedures, seek a second opinion from an appropriately qualified health practitioner. Always consult a licensed health professional for your specific concerns. Enjoy the show.